All right, I'm going to help Mrs. DeBurke take a short walk. So I have her gait belt in place. She's had a stroke, so she's weak on her right side, and we always want to stand on the weak side. So I'm going to hold the gait belt in the back, and I can stand either to her side or I can stand to the back, and I'm going to support this weak arm. So shall we walk down to the dining room?
Let's do.
Okay. There we go. There you go. Good job. Okay. Fun. All right. I want to show you canes. And there's different kinds of canes. We have just a regular cane here. This is called a quad cane. It has 4 legs. There are also canes that have a little rest for the elbow that come up the arm. But the main purpose of the cane is just to help a patient and assist the patient when they're walking. We always hold a cane on the strong side. So if somebody's helping me walk or ambulate, they would be standing on my weak side, and I've got my cane on the strong side. The cane and the weak leg go forward together. And then I can support myself with the cane. So cane and weak leg, and then I'm supporting myself. Now I want to explain crutches. When a patient has been ordered to use crutches, initially they will be non-weight bearing, so they can't put any weight on their foot or leg. The crutches should be fit to the patient so that there's at least 2 finger breadths between the armpit and the crutch. We don't want patients leaning their armpit on the armrest because they can get permanent damage to the nerves under the arm. So their weight should always be on their hands. So the crutches go forward first, and then the patient will swing through. This is hard, using crutches, I have to tell you. It is. Okay. So now our patient is starting to get better, and the doctor's ordered that our patient can have partial weight bearing. So the crutches go forward first, and then the weak leg or injured leg, and then the patient can use the crutches to take weight off that foot, and then they'll just step through. So crutches, weak leg, and then the strong leg. Always weight on the hands. And now we're going to use a walker. And there are lots of different kinds of walkers. Some walkers have wheels, some walkers have tennis balls, some walkers have hand brakes, some of them just have the legs. But the main purpose of the walker is just to help support a patient when they're ambulating. So if the patient has a walker that has the legs, they'll pick the walker up and make sure the walker's firm, and then they'll move the weak leg forward first, if they have a weak leg. If not, they can just walk naturally. If they have a walker with wheels, they can just move along with the wheels. There we go.